Hi friends, I am Dr. Ruchi Banthia. I am a periodontist. As the name of my channel suggests, perio passion, I am really passionate about my subject. So today I'll be discussing a very small topic, gingival recession. Hope all of you will learn something from this video. As this is my first video, I'm bound to commit certain mistakes and I'm open for suggestions. And I promise I'll improve in next videos. So let's start. So coming to my first slide, first we will like to discuss the definition and certain classifications. First we will discuss it on the line diagrams, and then this is a diagram which has been drawn by me because I am a chalk and duster teacher, so I like drawing diagrams, and then I'll be showing you clinical pictures. So definition, according to the definition given by Carranza, it is the exposure of the root surface because of the apical migration of the gingival margin. As we can appreciate in this diagram, that this is the apical migration of gingival margin and this has led to root exposure. So there are two classifications which I'll be discussing. One is by Miller and other is by Sullivan and Atkins. According to Miller, class 1 recession will be if there is no loss of interdental bone and soft tissue and recession has not reached till the mucogingival junction. This is the mucogingival junction. We can appreciate the muscle fibers. So this is class 1. According to Miller, class 2, when the recession approaches mucogingival junction and there is no interdental bone loss and soft tissue loss. That means interdental papilla and interdental bone are intact. And third is when there is mild interdental bone loss and recession has reached to mucogingival junction. And fourth, when there will be severe interdental bone loss and recession is approaching mucogingival junction. As you can see, there is no category like when there is a small bone loss and recession has not reached to mucogingival junction. But because Miller has not given it, we will consider it in class 3 only, because the prognosis or the success of your treatment will depend upon, this is a very important factor, interdental bone loss and soft tissue loss. So according to Miller, we have all these class 1, 2, 3 and 4 recessions. According to Sullivan Atkins, they have given a shallow recession, a deep recession, and then there is a narrow recession if we just consider the width of the recession, and there is a wide recession. They have not given any landmark. But after that, one scientist, Linek, has given that if the recession is broader than 3 mm, if you consider the width of the recession, if it is broader than 3 mm, it is wide, and if it is less than 3 mm wide, it is narrow. And same with the depth. If it is 3 mm deep, it is shallow, and if it is more than 3 mm deep, it is deep. So they have given the combinations like shallow, wide, shallow, narrow, deep, wide, and deep, narrow. So coming to my next slide, we'll be discussing this in the clinical pictures. Before I go to various classifications, there are two terminologies usually asked: actual and apparent gingival recession. Apparent gingival recession or visible gingival recession is when you can clinically appreciate that there is a apical migration of the gingival margin which you can see clinically. But actual gingival recession is the level of junctional epithelium, because we all know that attachment starts at C junction. And if junctional epithelium migrates apically and there is a periodontal pocket formation, that is actually actual recession. So from C junction to base of the pocket will be your actual recession, or what we call as clinical attachment loss. So if you just see this diagram, here we feel that there are gingival enlargements and there is only recession seen in this tooth, that is 4-1. But if when we have removed the excessive gingival tissue and we have exposed the flap, you can see how much root surface is exposed. So actual recession is this much, but clinically you are appreciating only a very small amount of recession. So this is after flap, when we have already, because there was recession already, and then we have achieved we have got this recession post-operatively. We will see clinical pictures. As you can see in this picture, this is a Miller's class 1 recession because the recession has not reached mucogingival junction and there is no interdental bone and soft tissue loss. And prognosis of this recession is very good. We can achieve 100% root coverage because this interdental bone and soft tissue will provide blood supply to the coronally advanced or laterally advanced tissue. This is Miller class 2. As you can appreciate that there is no interdental bone loss and soft tissue loss, but recession has reached mucogingival junction. You can appreciate this McCall's festune type lesion. This has reached the mucogingival junction. So, but here also you can appreciate that we can achieve almost 100% root coverage. Choice of the procedure will dictate that how much success we achieve. This is Miller class 3. Here there is mild amount of interdental bone loss and soft tissue loss. You can see this black triangle, and here the recession is approaching mucogingival junction. There is a frenum. You can appreciate that this is a mucogingival junction. And as you can appreciate that post-operatively we are not able to achieve 100% root coverage. There is a partial root coverage achieved. In Miller class 4, this diagram, this photo I have already shown you. Post-operatively, though we have done flap here, we are not able to do any root coverage procedure here, because if we just coronally advance the flap or laterally advance the flap, they will not be able to retain here because there is no bone and soft tissue to support this coronal migration of the tissue. This is another classification I was talking about, Sullivan-Atkins, and you can appreciate that this is a deep recession, more than 3 mm. It is a deep recession and it is wide, and in this it is deep but narrow recession. And here it is a shallow recession, less than 3 mm, and it is narrow, and here you can appreciate they are shallow. They are not approaching mucogingival junction, but they are wide recessions. That's all for today. Thank you so much for patient hearing. If you have any confusion, please contact me at 98268-69033. You can drop a WhatsApp message or you can directly call me. Thank you so much. Good day.